So the key to answering this question well is to start by emphasizing the importance of the role that nurses play. You want to explain that the healthcare system wouldn't function without the role that nurses play within it, because it wouldn't. And after that, you want to show that there are slight differences in the roles and responsibilities between that of a nurse and that of a doctor. So it's important to be aware of what those are. So you can draw on your work experience for that. You can explain that for nurses, they quite often are responsible for administering medication, taking observations. They will provide emotional support. They'll often see the patients for longer periods of time, because they tend to get a smaller number of patients that they are allocated the responsibility of. Out of hours, they quite often will escalate their concerns that a patient has become unwell to the on-call medical team, because doctors tend to, out of hours, be covering quite a large number of patients. Whereas the responsibilities of a doctor will include diagnosing and deciding management plans, and communicating that with the patient, changing medications, making sure that medications don't conflict with each other. So you want to approach the question, broadly speaking, by outlining the importance of the role that nurses play within the healthcare system, then describing just a couple of the responsibilities that nurses have, and then you pivot over to what doctors do, and you say, however, the roles and responsibilities of a doctor are X, Y, and Z, and they slightly appeal to me, and they appeal to me a bit more. So we've got an example answer, just because this can be a tricky question, so we'll just outline an example of a question format. Nurses have a vital role to play in the healthcare system. They administer medications, take patient observations like blood pressure and heart rate, and have many more responsibilities. However, doctors have a different job description that I feel appeals to me more personally. They will diagnose and make treatment decisions on various different diseases. And when I was on my work experience, I saw teaching of the medical students by one of the hematology consultants on the coagulation pathway, and they showed how this relates to diseases such as haemophilia and their treatment. This teaching illustrated to me that I would relish the opportunity to learn human physiology in greater detail, to the point where I can use it to come to a medical diagnosis. Therefore, I feel that medicine is a better fit for me. So you see there how we are emphasizing the importance of the role that nurses play, not being disrespectful to their responsibilities, just outlining that there are different job descriptions, and what the job descriptions of a doctor appeal to you more personally because of these reasons, and we're giving specific examples for that.